made me doubt whether my issues were severe enough to wait that amount of time, and made me doubt whether to seek help at all. So I'm so glad that I found somewhere with a shorter waiting list that allowed me to begin to get help and improve my mental health.
Hi, I'm Noah and I'm covering our second issue, which is the lack of awareness for mental health services. Many people have mental health problems and most of us don't know where to go. We have friends suffering around us and we are suffering ourselves, but a lot of us don't know the direction to go for help. I made a survey that was sent out to TDA sixth form, the people here in front of you today, and many other young people across Peterborough. A total of 66 people responded to the survey, answering 4 different questions. Just over 28% had no idea where to go if they were suffering with mental health issues, and a further 27.5% said they'd maybe know where to go. That's over 50% that wasn't confident in knowing where to go, and the fact that this is the majority really worries me, as most people will be suffering alone. Although around 40% knew where to go, the awareness for services isn't quite at a level to cover everyone's needs. There is also a lack of confidence with the services provided. 55% of the people said the quality of the service was below a good standard. That's still a large proportion that doesn't have complete confidence in the services provided, which may discourage them from seeking help from these mental health services. I also wanted to cover the fact that as young people have no guidance in what to do if our friends are in need. As covered before, waiting times are very long, which means someone needs to find help in the meantime, and that's likely to be our friends. Although 77% were confident in identifying a friend suffering from a mental health issue and was confident, and only 22.5% were confident in coping with their problems their friends face. I believe if young people in school were taught a way to identify mental health problems and knew how to help and guide other people, it would really go a long way to help people's health. The reason I feel so strongly about this is due to the fact I've struggled with supporting my friends in the past, and I myself have not been in that position to have no guidance in this area. This made me uncomfortable. The person came out of their comfort zone to seek help, and I couldn't provide the support they needed, making it worse for them. If there was a service provided by you to teach people's peer-to-peer support for mental health sufferers, it would relieve pressure on you and saving you money while also doing right by supporting people while they wait for professional help.
Hi, I'm Charlotte, and the third issue our listening identified was the initial assessment and the initial assessment process and their challenges. This testimony is from a young 14-year-old pupil. The first time I started the CAMS referral process, I found it overwhelming and ended up not going any further than the assessment session. Having had previous experience with the referrals process and finding it very stressful, I was hesitant in trying again, even though I knew I still needed help. This left me worrying about how the referral process would go. I voiced my concerns about my parents not being present to my referrer and said I was worried about going forwards. She reassured me and told me that she had passed my concerns on and requested for me to have an appointment without my parents. And we were then told they would look to accommodate me. This made me feel more at ease and less anxious, as I knew I'd be listened to in my appointment and it would be in confidence. However, when I went to my appointment, my parents were invited in with me for the whole time, despite me specifically asking for this not to happen on multiple occasions. I ended up only having a few minutes at the end of my appointment on my own. This increased my stress and anxiety, as I felt like I did not get the opportunity to say what I wanted to talk about in confidence. This defeated the intention of my appointment, as I did not feel like my concerns were listened to, as the majority of the session was aimed at my parents. The young person's voice was not heard, and this was their first and only appointment the young person attended. This upset me, as I felt there was a breakdown in communication that resulted in the young person's voice not being heard and being filled with a false sense of hope before her appointment, making her less likely to reach out again due to the lack of support she received. I took it upon myself to do some research to find out about other people's experiences with the CAMS service, and I was overwhelmed with the vast amount of one-star reviews I was seeing about the unruly waiting times, missing appointments, rude receptionists, and patronising workers. I have picked out some small quotations from a few of these reviews. Confused, unwelcome and uncomfortable, feeling worthless, lack of support, patronising, filled me with so much false hope. My issues didn't matter to them. After researching for this project and finding that Cambridge and Peterborough are in the worst 12 performing areas in mental health in the country, I'm starting to wonder if the whole system needs to be reviewed. The last issue we would like to raise is the need for COVID crisis response. The pandemic has put a huge strain on many young people who were and weren't already struggling with their mental health because of self-isolation, a loss of routine, and a breakdown in formal and informal support. I conducted my own study in King's and on social media using a survey I created which received a total of 331 responses. I found that 15.6% of people who described their mental health as poor before COVID increased to 43.7% now. 62.8% of people in the survey said being back at school has had a positive impact on their mental health. However, 59.4% of students think there isn't enough support in schools for their mental health. In this survey, I asked the question, what do people think has affected their mental health the most throughout the pandemic? The highest three factors were loneliness, 45.8%, interrupted learning, 43.7%, and GCSE/A-level/exams at 39.4%. Many students also mentioned there are many fears and anxieties around not knowing enough content for exams, also causing stress. A large proportion also mentioned that being away from friends has caused a loss of friends as well as missing them constantly. Students are missing the activities outside of school, most particularly sports and exercise. In the survey, some of the results worried me particularly. The number of adolescents who have mentioned their first time committing suicide or deliberately hurting themselves as a result of consequences due to the pandemic. One person wrote, "Lockdown made them realise existence is pointless," and another called COVID the devil's breath, as it has ruined so much. Many adolescents have also spoken about hopelessness, as they are no longer able to look forward to things. It's all been taken away. The constant closing and reopening of schools has caused increased uncertainty and anxiety amongst adolescents, hence affecting their mental health. As well as this, another student has shared a personal experience with me that I'd like to share. She recently lost a loved one due to COVID, which has left her and her family grieving through the third national lockdown. As a result, she has struggled especially as there is no control over the situation. Having not been in school has particularly made it difficult for her as there is no distractions or friends to comfort her in ways which we normally would. I'd like to finish with one final testimony showing the impact COVID has had on them. They said, "I have generalized anxiety disorder. Currently, I'm at the lowest I've ever been since all my coping mechanisms that I've built have been stripped away by COVID. My lack of control means I can become violent towards others and myself, and I was eating disorderly for around half a year and considered self-harm. The impacts of COVID has had on us as adolescent mental health is drastic, and it's imperative that something must be done about it."
Wonderful, thank you for your testimonies. I'm going to just pass over to the research group that have been working on researching the mental health within Peterborough. So the screen is just going to share and I'll pass it over to Amelia and Amira.
Hello everyone, I'm Amelia from the Peterborough School, and along with Amira from TDA, we will be presenting research surrounding mental health and young people in Peterborough on behalf of the research groups from our school. Next slide please. Firstly, I will be explaining the purpose of our research. We think it is vital to better understand the context of mental health services and support for young people in the city, as well as trying to make sense of stories and testimonies we have heard, and to identify gaps in our knowledge and to seek the help of Cambridgeshire and Peterborough CCG to address these gaps. Next slide, please. The Cambridgeshire and Peterborough CCG is one of the largest in the country, comprising of 86 GP practices. They have an annual budget of 1.3 billion, which works out at just over £1,000 per person. However, despite being one of the largest CCG groups, we are one of the least well funded in England. Next slide, please. I will now discuss the demand for services. 27% of the population are children or young people. However, 1 in 5 children or young people live in poverty, and 34,000 live with a diagnosable mental health disorder. Alarmingly, 35% of 11 to 16-year-olds with a diagnosable mental health disorder are from Peterborough. Next slide, please.
Hello everyone, I'm Amira from Thomas Deacon Academy, and I'll be moving on to speak about the current existing services and support available for the youth in Peterborough. According to Young Minds charity, less than 1 in 3 young people with a diagnosable mental health disorder get access to NHS care and treatment, and it's been forecasted that in Cambridgeshire and Peterborough, undiagnosed mental health issues will increase by 10.3% in 2021. keeping in mind that these figures disregard the current pandemic and lockdown we are currently facing. The Prince's Trust study found that 1 in 4 young people have been unable to cope since the start of the pandemic. Also, if we compare the average waiting time in Peterborough and Cambridgeshire for young people to receive an initial assessment and access to treatment to the national average, it is evident that there is a 44.6% higher waiting time of 81 days compared to the national waiting time of 56 days. Therefore, putting Cambridgeshire and Peterborough in the top 12 worst performing areas nationally for mental health, as even in 2019 and 2020 there still hasn't been much of an improvement. Next slide, please. Furthermore, there are limited services available in Peterborough, currently meaning that there are long waiting times to speak to someone. Also, for those who wish to educate themselves in order to provide support, for example, parents, teachers, and young people who do wish to help, there are limited courses available specifically in Peterborough, and many of the online courses that we found were only moved online due to the COVID situation, as they were usually face-to-face. Next slide, please. As part of our research on services and support in the city, we wanted to know about the accessibility of mental health services in the city. We found that there is limited advertising for mental health services in the city, and many of the services, excluding the NHS, are solely catered to extreme cases, such as those at the point of suicide, rather than intervening at an earlier stage before the mental health issues further amplified. There are many GP surgeries in Peterborough with online booking systems, but these require registration in order to attend. So to conclude, after conducting our research, we have been able to identify some prominent gaps in the mental health services and support available for young people, and we have some questions we hope we could address. Thank you.
Thank you for sharing your research and all of your experiences. We'd now like to ask you if you would work with us on one specific issue that we've discussed altogether. Could we work with you to better the access of what mental health services are available to us?
To achieve this, 5 of us would like to volunteer our time to research what services are available to us from home, how far it takes to travel, how we can get this information and communicating this information with schools, and we work together to create an accessible online site which shows which services are available.
Wonderful. So I'd just like to open the floor for some questions and answers with the students and Catherine Goose and MP Paul Bristow. So the first specific issue the students would like to address with Catherine.
Sorry, can I just check? Do you want me to answer in response to the access to the point that was just made? Yeah.
Yes.
Right.
So, Becky, did you want to just ask the question specifically again, and then Phoebe, you can ask each question to Miss Goose.
So we were wondering if we could work with you to better the access of what mental health services are available to us.
Thank you, Becky. Yeah, please do call me Catherine. Yeah, no, absolutely. It would be really beneficial. So about 5 years ago, across Cambridgeshire and Peterborough, we set up a website called Keep Your Head. And this was a website that was initially pulled together with Cambridgeshire Regional College. And it was meant to be, the principle of it was around for young people to access and find out about local information. However, what we have identified over time is this is a website that has been used very much by professionals, and we've had a meeting actually last week about how do we get it more user-friendly, how do we ensure that young people can know what's out there, and I knew that today was coming up, so it's actually a prime opportunity. So when we were looking through it, there's lots of information. You know, I'm not a young person, therefore actually your voice and you telling us how you want information structured. Is it around an app? Is it around a website? Is it around leaflets? How is the best way to get information? We would absolutely really relish you to help us formulate that, because we developed it 5 years ago. Technology has changed, the way we access information, the use of social media has progressed in that time. So we would very much welcome a group to help us look at what we've got, how we can make it usable, and how we can promote it. Because I think we've got a basis there, but I think listening to yourselves, actually it's not as well known as we want it to be. And as I say, I think what's happened is that it's become something that's been promoted to to primary care, so to GP practices and also to schools, but it's not filtered down, it's not got out there to young people and to families. So yeah, very much would welcome support to do that, if that's something that you would like to and be interested in helping us with.
Yeah, 5 of us would like to volunteer our time to research what services are available to us from our home and how far it can take to travel to them.
Yeah.
Additionally, we would like to ask, how can we get this information and communicating this information with schools?
So,
and
sorry, carry on.
Oh no, sorry, you can go.
So yeah, so you want to look at the information, so how far from your house to getting to support. Yeah, so we could certainly do that. I mean, I think a way to do that would be to set up a small working group with myself, and I have a commissioning support manager. We could work with you, the 5 people, to work out how we do that, how to get that information, to look at that. So yeah, very much happy to take that piece of work forward with yourselves, to look at that, see what we've got, see how we use it. I think we almost need to look at what we've got. You tell us really honestly, is it useful or not? Have we got the start, or do we need to start again and think again and how we do that? And then certainly we've had conversations about how we use social media to promote messages, and again, understanding the best forums that you utilise to help get those messages out, and the way to do that in an engaging way would be really important, because I think some of the information is quite dry, it's quite professional, it's probably it's not as easy to access, and doesn't grip you, and it's not as sort of instantaneous as it could be. So yeah, very welcome to that.
So do you think that we could work together to create the accessible online site or app or whatever, which shows us which services are available?
Yes, definitely, yeah.
For the second broad issue we would like to work with you is the question, could we work with you to increase demand for mental health, to address the increase of demand for mental health services as a result of COVID? Will you work with us with the response of COVID and mental health issues raised?
Thank you so much. That's such a great response. Also, I've seen the second question is both to Catherine and MP Paul Bristow. So if you would like to have some response there, MP Paul Bristow, that would be wonderful.
Well, yes, is the answer to that question. You know, I would love to work with you on how we can raise awareness of some of the challenges around COVID. I mean, the thing that I took away from the discussion, and I know you've got this in a structured way, and I don't want to veer away from the way you've structured it, but from the presentation that I saw, I've been taking a few notes, and I think, you know, it really does kind of gear towards sort of 3 sort of issues, really. I mean, I think the first is accessibility, and that's what you've just talked about, whether what is that geared towards GPs and primary care professionals rather than towards young people. And I think the idea of you guys, that five people working with Catherine and her team to, you know, look at that is, I think, really, really important. And I would love to be kind of at least part of that and informed regularly about what's going on with that. The other thing is that I want to ensure it's suitable for the audiences of my city, or Peterborough, because, you know, Peterborough's a diverse place. It's no, when we talk about young people, we're not talking about just one group of people with the same accessibility issues. You know, there are all sorts of different communities in Peterborough who probably have different challenges around accessing information around mental health, and I just think it needs to speak to all communities and all young people rather than just one element of it. So that's just a challenge I'd kind of put out there. There were just 2 other issues there. The first was funding. You know, I know Peterborough and Cambridgeshire is not funded adequately. It's something I'm already aware of. You know, that's something for me, I guess, as a member of Parliament to lobby on. I think some of the challenges around Cambridgeshire and Peterborough around the formula which is used to allocate funding, I don't think it captures everybody who effectively lives in Peterborough, because Peterborough's got quite a lot of hidden populations who don't show up on censuses and things, and the same applies to our formula around local government funding, if I'm honest. It just doesn't suit Peterborough. The formula used nationally to allocate money just doesn't suit Peterborough. But it's something I'm already talking about, and that's a challenge for me to come back to you and tell you what practically I've done to make that more appropriate for an area like Peterborough. And then finally, you talked about awareness, mental health awareness, and about COVID in particular. I know the last speaker asked that question around what can we do around COVID. I was in the car dropping off my baby daughter to nursery, which was basically driving on an ice rink earlier today. And one thing, I was listening to the radio, and I heard one caller speak about COVID. And he said, because the debate was about schools and going back to school and all the rest of it. And the caller said, well, we're just focusing far too much on young people. Young people, I've got no challenges around this lockdown. It's affecting, people who need to go to work and everything else. And I just couldn't believe the attitude towards that speaker. And to be fair, someone did come back to him and say, look, young people are almost being destroyed, their future's almost been taken away from them, in the sense that, if they've got exams and things that they need to be preparing for, their schoolwork and, is suffering. But also, the element of being a young person, you're not be able to see your friends, you're not be able to see your family, you're not be able to play organised sports. And that's got a huge impact on mental health. And I just thought that was very ignorant comments. And I just don't think perhaps the debate around COVID has focused as much upon how we're robbing a generation of a year of their lives and the impact that's having on young people. So look, I'm very, very willing to work with you on what I can do to raise awareness of what this COVID pandemic and the effect it's having on young people, because I just don't think that debate is being had in the way it should be.
I would like to echo a lot of what Paul has said.
Okay, thank you very much, Mr. Bristow. We just wanted to ask, okay. Were you saying something?
Sorry, it just broke up there. Were you just asking me if I was about to say something?
I was going to ask, yes, I thought you were going to continue with what MP Paul Bristow was saying. Is that correct?
Yes, sorry, I'm not sure if it's your end or my end. It's a bit stilted, the connection. Yeah, what I was going to say was I would agree that the impact, and I'm very, very happy and very willing and want to work with you around the COVID, because I do agree also that the impact that COVID's had on young people, I also have concerns about that. One of the challenges that I have in my role is my commissioning role goes up to 18, and actually a lot of sort of young people, sort of 16, 17, 18, it's not this sort of arbitrary cut-off. You get to a certain age and then you go into adults. And so one of my roles is I need to work with my adult commissioning colleagues to make sure that young people are progressing through, because this is not something that's just going to impact on people for the next few weeks, months, as we're still going through this. This is going to be an ongoing scenario. So I think how we support young people as they transition from young people services into adult services is also really important. And I do think that the impact that not being at school, having this complete disruption, isn't necessarily, we don't understand it and we haven't played it through. And I think we could work together to think about how we do that and how we support in a timely manner as well. I think that would be really important. So we are very happy and willing and wishing to work with you around how we can do that in a constructive way.
So can I just say one more thing, just on the challenge and how I can work with you on what it is I can do. Obviously, there's a lot of parliamentary activity at the moment around COVID and around lots of opportunities to ask questions. Not as many as there should be, but there's lots of opportunities to ask questions to ministers and debate COVID generally. And maybe some of the arguments about how COVID has, as I say, impacted young people, especially the areas of mental health, probably hasn't, as I said earlier, hasn't had the attention it merits. So here's a challenge to you. Why don't you send me a list of questions you would like me to ask ministers about this subject, specifically about COVID and mental health. And I'd either ask them in a general debate if I get called, or if I get called to ask a question to the Secretary of State for Health and Social Care, or indeed Education, I can ask them at those opportunities. Now, I can't promise I'll be called, but if I am called and you do give me your list of questions, I can promise you I will ask them. So at the very least, I'll put them down as written questions if I'm not called. But I'm very happy to do that. If you can provide me, 6 or 7 questions you think are appropriate, I'll pick a few and get them on the floor of the House of Commons if you feel that would be useful.
Wonderful. On the note of asking questions, I believe Amelia has some questions that were raised by the research, which we are going to present now.
10% of the annual CCG budget is for mental health services. How much of this goes to children and young people, and is this ring-fenced?
So how much of that I would need to go back and find exact figures for you, but I'm happy to do that and come back with a definitive answer. How much of this is ring-fenced? So we do have an overarching, what they call mental health investment standard, and it is partly my job and my manager's job to fight for children and young people and make sure that we get a fair allocation. I think it's fair to say that historically children and young people's mental health has not had equity in terms of funding comparable to adults, but over the last year we've really fought hard to do that, and we do have specific pieces of funding that are for children and young people's mental health. There was a programme of work that started a few years ago called CAMS Transformation Funds, and we were fortunate that we were able to utilise all of that for children and young people's mental health across Cambridgeshire and Peterborough. Some areas weren't. However, as your research has shown, we are at a really low funding basis. So actually, for some, in lots of ways, that's just brought us up to where other areas are. So it's a continual thing that we need to progress and make our case for funding children and young people's mental health services. And that's something certainly that I feel quite passionate about and feel that we need to do. But yeah, I can come back to you with exact figures around that proportion if you would like.
Thank you. Is there any weighting of resources towards areas of greater deprivation and need? For example, Peterborough has around a third of children and young people with a diagnosable mental health disorder for the whole of Cambridgeshire and Peterborough.
So historically, Cambridgeshire and Peterborough, we have distributed the resources across, and we've not, so I know one of the questions that posed before around about Cambridgeshire and Peterborough, and we don't necessarily split it up like that. However, where we are moving to now in health commissioning is actually looking at health inequalities, and that actually some areas do have greater demand because of their population and the needs of their population. So it is an approach that's now being taken within health commissioning. We're quite early on in that, so I would anticipate that over time, because of the complexities of Peterborough as a population, there would potentially be more swaying towards Peterborough, but that's not how we currently or have historically done that. But that is a way that health resources are being now allocated, looking at inequalities and inequity and making sure that you focus your resources to your population who needs it most.
Thank you. Is Cambridgeshire and Peterborough still one of the worst performing areas in terms of waiting for initial assessments and accessing treatment? How does Peterborough compare to the rest of Cambridgeshire?
So our waiting times are, it's been a challenging time during COVID. So as you noted in your research show, we were really poor in terms of our waiting times prior to COVID. At the beginning of COVID, there was a bit of a shift in that, and that was around how some of the services changed their assessment process, but it was also around actually during March, April and May, we had a lot less referrals into services. So services could kind of get through some of that backlog and waiting list went down. However, now, and that came about from people being a bit anxious about going to services, not sure if services are open, multitude of things. That has now changed and waiting lists are going back up. How does Peterborough compare with the rest of Cambridgeshire? Peterborough is not particularly worse than Cambridgeshire. It very much depends on the service and the need, which service you're being referred to. So it's not as simple as saying Peterborough is worse than Cambridgeshire or Cambridgeshire is worse. And also it will depend on where you are within Cambridgeshire, what the service you're waiting for. So it is something we're very aware of, and I know that services and I have many conversations about how we can address this and how we can work that, and we know that we need to do better than we are, and therefore we are looking at the processes and that initial treatment. And I took note from that scenario that was the case study that was presented about that assessment process and not listening, and that's something I think would be really helpful to feed into the services as well, to actually hear that, because that's really important. That's real life. That's how it feels from the the young person's end, and that's really important.
Thank you. Your pre-COVID estimation of the increase in children and young people with diagnosable mental health disorder was 10%. With COVID, however, there is a fourfold increase in children and young people with diagnosable mental health disorder. What is your strategy for coping with this?
So that's a really good question. So in terms of strategy, we do have our local transformation plan, which is our strategy, and we are moving towards the NHS long-term plan, which needs to amend itself in terms of COVID. So that was written pre-COVID. We are looking at all opportunities we can for additional funding and any resources that we can around COVID. I think to Paul's point around about questions and debate, I think a lot of the focus around resource has been around physical health, and we do need to continue to lobby and to ensure that we've got adequate resources for mental health. I don't think we're there yet, and I think we need to pursue that.
I know MP Paul Bristow has to leave in a couple of minutes. We just had a specific question to ask MP Paul Bristow in terms of funding. I believe, Amelia, if you could ask the question about funding and how we can work together, that would be wonderful. So how could we help you making the case as you lobby for more funding?
Okay, so as I said, I think the issue around funding, and unless Catherine's going to embarrassingly contradict me, I think one of the major issues around funding is that funding settlements. So there's a formula that's applied to determining how much money each area gets. And certainly in terms of local government, this is the issue, and I would imagine it's the same for the health service as well. It's based, that formula really doesn't suit a city like Peterborough. They assume Peterborough, for example, would be like Northampton, or would be like similar sort of size places, and in fact it's not, because there's lots of hidden people living in Peterborough which will not necessarily show up on a census, and the sort of people I'm thinking about are those who engage in casual work, et cetera, et cetera. And so, and it's a changing population. It's not, the population of Peterborough is not the same as it was 10 years ago. when the last census took place, because Peterborough was like the 4th fastest growing city in the UK. So that for me is one of the real drivers towards underfunding of public services in Peterborough, because it does not reflect our actual population size. And so what I need to do is I need to challenge the funding formula and make sure that works for Peterborough. And so that's the fundamental thing I can do. But as Catherine said, there are lots of pots of money. There are lots of other initiatives that the government are coming in, especially around COVID, to make sure we get the money that we need. And we've been quite successful on that in terms of rough sleeping and one or two others to get extra money for Peterborough. In terms of how you can help me, the best thing you can do to help me is some of the questions and some of the issues that you would like me to raise. I am your Member of Parliament. It is my job to raise issues that you bring to me. And the best and the most visible way of doing that is, I think, through questions in the House of Commons. So if you're able to give me that list of questions, they're like, that's like my armoury, if you like, to go into battle with for Peterborough. Because if I don't know a lot of the issues and I'm ignorant of a lot of the issues, I'm not going to make a very good case. So I need you to help me. And so it's not just a nice, I'm doing it to say because it's a nice thing to do. I need those questions and that input from you in order to do my job effectively. So if you are doing that, I'll be incredibly grateful. But you must forgive me, because I need to shoot off at the moment, and I'm terribly sorry that's the case. It's very rude of me, but I've got a conflicting appointment at 10:45. But this is so impressive that you're doing. I'm, as I say, incredibly proud that young people in my city are doing this. I don't know of this sort of initiative anywhere else, so you should be very proud of yourselves.
Paul, just 1 second before you run off. If there's any other way that we can help you to get to those populations you can't see, then please tell us, so we can support you with that.
Yes, absolutely. In terms of the citizens, yeah, that I understand that's something that you would do and support me with. So that'd be very, very helpful. So thank you very much.
Thank you.
Take care. Bye bye.
Wonderful, thank you. So let's move on to Becky and Abdul for next steps.
For our next steps, we would like to meet with you, Catherine Goose, in 2 months' time on the 23rd of March at 3 p.m. to begin working on the 2 issues that we have discussed. Ms. Goose, would the CCG be willing to work with our mental action team on the above issues? Specifically issue 1, which is to better mental health access.
Oh, sorry. Yes, so I was having an issue with my mute button there. Yeah, absolutely. Yeah, so and I think I just saw a message pop up in the chat about or earlier than the 23rd of March. So yes, absolutely, very welcome, very happy to meet with you and meet earlier than the 23rd of March if that's suitable. The next few weeks in the CCG are quite challenging because of the vaccination programme, and my background is I'm a registered nurse, so I will be called to help. So there is going to be some limited capacity, but I think certainly within February there will be time. So I'm happy to bring that forward before March, and certainly the piece of work that I spoke about in terms of the website, that would be good to do that, because I think actually getting that information out there as soon as we can in a way that's usable is really paramount. So yes, very, very happy to do that. To work with you, and I'm sure we can find an earlier mutually convenient time. That would be absolutely fine. Very willing to do that.
We are so pleased that you'll be working with us in March, and we will send you a calendar invite, and our dedicated team will be ready to work with you. Thank you once again.
Just to say thank you to everyone for attending the meeting today. We look forward to the outcome of this advantageous relationship to better the mental health of young people in Peterborough. Dil Rajkul will now conduct a short optional evaluation of today's meeting. Thank you for your dedication for social justice and the common good. Thank you.
Wonderful. I'm going to introduce Dr. Tim Hall, who is a lecturer at UCP to do the evaluation, but also absolutely fantastic with the dedicated team, and what a fantastic outcome of having working with the CCG and MP Paul Bristow. And we've got a dedicated group of students at the ready and very keen to work with you all in improving the access of mental health, and also questions to lobby more funding for specifically Peterborough, and working with Paul Bristow for those specific questions. So absolutely excellent, and we are going to follow up with emails and a group of students that will be working very closely with the CCG and MP Paul Bristow. And thank you for putting this all together, and what a fantastic outcome. So Dr. Tim Hall, who has worked with citizens in the past as well, and had some absolutely fantastic success outcomes in East London when he worked with Citizens UK, and has now, we could say, been the founder of Peterborough Citizens UK as well, although he's very humble about it. So he will now conduct an evaluation of today's meeting. Well done.
Thank you, Dilraj, and thank you, everyone. Thank you, Catherine, if she's still with us, for your time and for agreeing to work with us. So, as you know, those of you who've done this before, this is an action today. It's not a talking shop. We have. You've all done brilliantly and gone out and had conversations, spoken to your colleagues. Some of you have done some research as well, brilliant research, brought forward your testimonies, and this is an action today. And we always evaluate actions. So please, one word, either if you want to, you can, I'm going to just run across the top here, and if you could also put that word in the chat line. How are you feeling right now? Anybody? I'm gonna pick on people. Phoebe.
I'm feeling very positive and very happy about the outcome of today's meeting.
Thank you, Irini.
I'm feeling very optimistic, happy, excited about what we're going to achieve.
Charlotte.
I'm feeling very positive and optimistic for the future.
Noah.
I'm very excited to see what we can change.
And oh gosh, the order has changed on the top of my screen, which is not helpful. Georgia.
I'm feeling really proud of us all for coming together today to speak about this.
Becky.
Hopeful.
Abdul.
I'm incredibly proud of what we have achieved, and I'm absolutely enthusiastic.
Those two are the ones that I really like, unless there are any.
Lucas, can you hear me?
Yeah.
I mean, I do quite
like how are you feeling in one word?
But it's not as great as the other.
Positive.
I'm going to ask. I'll see if I can't pronounce your name correctly. Us teacher.
It's Staya, and I'm feeling inspired and excited.
Amelia.
I'm optimistic.
Daria.
I'm feeling really proud of all of us and how confident these young people were today.
Amira.
I'm feeling positive about the outcome of this meeting.
Alicia.
I'm feeling faithful to see what our generation can do for mental health.
Erin.
I'm feeling inspired and proud to be a part of this.
Julia.
I am excited to see the change that we are going to do together.
Tonio.
My heart is full of joy.
Alithia. Althea.
I'm super excited about this and I feel privileged to be a part of it.
Flora.
I'm feeling really positive and proud.
Emma.
Yeah, just really constructive.
Sebastian.
Okay, yeah.
I feel positive and approach this topic.
Vanusa.
I'm feeling happy and positive and excited for the future.
Jasmine.
Or the one with the arms that
I'm
the other
feeling
one with the
really
arms that go around
positive.
slightly. Yeah,
Rebecca.
those are the two I like. How much would one of those cost in the yellow?
Okay, got you. I think everybody else is either a teacher or journalist, etc. So I'm not going to ask you how you're feeling. Why do we ask how we're feeling? Because very often you remember what you were feeling on a political action, on a social action, rather than the arguments and the nuances of the argument, and we want to carry that forward. Evaluation, what did we do well? 3 things that we did well with this meeting. We worked on this. This is our event. This is our action. 3 things that went well, 3 things that could have done better. Please drop them in the chat line, or if you want to take the mic, feel free. Three things that we did well. So I prompt sharing. How did the chairs do? Sorry, my mic's on mute. Gathered accurate research. Felt like we were listened to. Important stats. As chairs, did they do a good job? Let's see. Yes. Good engagement with Paul and Catherine. Great chairs, I agree. I think they did a brilliant job. Testimonies, really strong, superb testimonies. Great. Okay. So with every social action, with every action we undertake, there's always something that we could have done better. Drop down a few comments, please, or if you would like to take the mic and feedback. 3 things that we could have done better. Internet connection. Yes. That's our next task. We'll get the internet providers in. Anything else? Possibly more visual content. Yes. See, to me, we gave them a lot, didn't we? We threw a lot at them in terms of the research we did, in terms of the the testimonies, the questions we want to ask them, etc. Background noise with speakers, that's me, I think, homeschooling, etc. going on. If you send out PP to people involved in order to reflect. What do you mean by that, Emma? PP to people to involve?
Oh, the PowerPoint, sorry.
Oh yes, share that in advance, possibly. Okay. Has anybody, anything else that we could have done? We kept the time well. You know, obviously the people that we're bringing in have limited time and we need to make the most of that. The final bit is what mark would we give ourselves in terms of our action today? How would we rate that? Being A star, off the scale, really good, you know, down to C's and D's, etc. Straight A's at the moment. My word, everybody's pleased with how it went. A star, my word. Well, that's fantastic. A double star, that really is off the scale. Okay, so this is great. We just bringing this evaluation to a close. I'm glad that everyone's you know, so positive about what they've done. Politics doesn't need to be, this kind of thing doesn't need to be an unpleasant experience, divisive, etc. It can be fun. You've all done loads of work, so congratulations to our chairs, congratulations to those that have contributed by way of testimonies, by way of research. Thank you to James, Lucy and Julie for coordinating, Erin for bringing in her students, and Michelle, sorry, of course, from Peterborough School, and onwards and upwards. I think there's a group doing media interviews now, so have a look on your local paper and the local news tonight to see if this made it on. So thank you, everybody. And back to homeschooling, I guess now, and we'll see you at our next event.
Lovely, thank you, Tim, for evaluating. So I'm just going to conclude on the fantastic actions that you all created today. So in terms of your first action is we've got a group of dedicated students that are going to be working with Catherine Goose. We'll be meeting with you in February, March to work on the access and improving the access of mental health within Peterborough for the schools and young people, and how that communication can be even better or better. And the second is a group of students will be working with MP Paul Bristow. We'll be meeting with him in the next couple of months to raise questions on how we can lobby more funding for mental health for the young people in Peterborough. So absolutely well done. That was an excellent action, and so pleased to be with such a dedicated group of students, and so many of you want to work on the actions as well. So absolutely excellent and well done. I also just had a question. I know, Kim Coley, did you want to talk a little bit about the interview now, or is it happy to talk about it tomorrow and what you needed for that? If the rest of you needed to go, that's fine. If you wanted to hear a little bit about the interview now, Kim Coley, could you just inform us of what you needed for the interview for Peterborough Community Radio, please?
Hi, I've written notes throughout, so I think I've got everything I need. And then Dilraj, you're going to be on PCR FM tomorrow morning for about a 5-minute interview between 7 and 9.
Lovely. Okay, so you don't need anything from us now. Fabulous.
No, thanks. Well done, guys.
Thank you very much. All right, brilliant. Well done, everyone. And we'll be in touch, and we're going to be regularly meeting. And if you specifically want to work on the action group, what I'm going to say now, I'm going to put my email down. So could you all just take that down now? I'll put it in the chat. Okay. Let me know whether you want to be part of the action team to work with the CCG, or you want to work with the second action or working with MP Paul Bristow. Take down my email, I've put it in the chat right now, and email me to tell me what specific action you want to work on, and then we'll put dates in the diary with when we're going to be working on those specific issues. So ensure you email me. If you don't email me, I can hear them already pinging, so well done for those of you that are doing it. Then yeah, we can move forward from this, but absolutely brilliant. Well done, everyone, and enjoy what's left of the snow. Bye.